The initial catalyst for the Washington County Coalition was Dr. Bandola, who was a provider in the community, called a number of different providers and to kind of vent and talk about issues that we were having with the hospital. The light bulb went on about 3/4 of the way through this meeting, and we all kind of looked around at each other and said, wow, we can get some things accomplished here.
Slowly but surely the word is getting out that you want to be part of the solution, and in order to do that you need to join this group, you need to bring your voice to the table, and more importantly, you need to take action, and that's why this group is so successful.
A couple of meetings in is when health-centric advisors came into the picture, and we became aware of that QIO role, and we were on board with it right away.
We did come into an existing coalition, and we needed to figure out what we were going to do to add value to a program that had great interventions in place, but they weren't measuring them. So there were two things we said we were going to do. One is help them measure and show their success, and the other was highlight their success. And we've been able to do that. The Washington County Coalition is provider-driven. It's run, it's led. The actions are based on what the providers want to do, and that's going to create sustainability.
It started with providers. It started with two providers coming together and pulling in people that they knew could solve some of these problems.
We think outside of the box. We encourage everyone to come to the table with different ideas.
When we got together, we decided that a shadowing program was the best way to do that.
So it's spend a half a day in my shoes, and they go into the other facility and they get to see what that other person does.
And initially, one of the outcomes of the shadowing program was the institution of a nurse-to-nurse report between hospital and skilled nursing facility.
We also utilize pharmacy students at URI. They're working in the hospital, they're working in home care. So they've done a lot of really creative things.
Collaboration and communication are critical to making a successful change, to improving patient care.
I think initially some people are reluctant to come to the table because they have to air their dirty laundry.
And it wasn't about blaming, it was more about identifying problems and coming up with solutions.
We want to talk about issues and concerns. We want to do that constructively.
We are patient-centered. We are always looking to see how patients are reacting, getting patients' input, and trying to provide the best quality of care for patients.
At our coalition meetings, we usually open up the meeting with a patient story.
He went from one setting, the hospital, after a fall, to another setting, got what he needed there, was hooked up with the right information, and is now going home to the home setting, which is what he wanted.
Slowly but surely, we're moving from a patient-centered, where we're thinking about the patient at every meeting, to a patient-directed, where we're actually having the patient involved in the work, in the room, and guiding what we do next.
As a coalition, it's unique, but I don't think so unique that it can't be carried across all lines of business.
We did institute a liaison in the hospitals and several of the local skilled nursing facilities, and it wasn't a one-size-fits-all because each facility has their own goals for what they see would be beneficial from that relationship.
We really are trying to align the efforts so that it's a full community solution.
A lot of people that have just an amazing commitment to healthcare, not just on a professional level, but there's a personal passion, and you can see that personal passion in everyone that sits on that coalition and comes to our meetings.
We're caring, we're innovative, and we're passionate about providing good, sustainable health care for everybody.
Patients are benefiting because providers are talking.
I think it's more than sustainable. I think it's a model, and I think anyone in healthcare would be crazy not to want to get involved. It just doesn't make any sense not to do this.
is that she has done us a great favor, and we are going to have a quick little fun event for you. We have to get ready. So my colleagues over there in Colorado, do your thing.
Degree. So a man with 4 college degrees is dressed as a penguin because you all did such a great job. And I'm so incredibly proud of the work you did. So this song is for you. Hey there, you deserve some applause. I said, hey there, you nailed out the root cause. I can hey there, now it's giving you pause to celebrate. Intervention, hey there, there's a place you can go. I said, hey there, it's your state QIO. You can take on from the quality pros to sum up for free admission. It's going to work with the ICTC. It's going to work with the ICTC. If everything going to succeed, you will let everyone. It's going to work with the ICTC. It's going to work with the ICTC. You can get good advice. You can measure your let's get actualized, plain discharge. Let's make it standardized. I said standards. Keep receivers applied for the we can go it alone, let's do it together. Don't go alone, now we get it. As a community, we can get through transition. It's going to work with the ICTC. It's going to work with the ICTC. They hold interesting calls and events to enjoy. Say your name and what state you're from. Going to work with the ICTC. It's going to work with the ICTC. You can get good advice, talk about challenges, share successes with other teams. We were watching your shoes, we had missions. Gave us walkers for blues, care transitions. What's the name of the game? But improvement can be so late. That's when someone came up to me and said, hey there, get online and you'll see it's all place there. Call the ICPC, they can get you marathoning. It's going to work with the